Hi everyone, my name is Clifford Chen and I am the PGY2 Oncology Resident at Monument Health. Today I'll be presenting on Telisotuzumab Vedotin. Its brand name is called Amrelis. Telisotuzumab is a relatively new drug that was approved on May 14, 2025 based on the Lumosity trial. This is a c-Met-directed antibody drug conjugate that is used to treat patients with locally advanced or metastatic non-squamous non-small cell lung cancer with high c-Met protein overexpression that involves at least 50% of tumor cells with strong 3+ staining. This is specifically for patients who have received prior systemic therapy but still experience disease progression. The way that this drug works is that it binds to c-Met expressing cells and then undergoes internalization and intracellular cleavage of MMAE, which stands for microtubule inhibitor monomethyl auristatin E. The way that MMAE works is that it disrupts microtubule network of actively dividing lung cancer cells, and then this leads to cell cycle arrest and apoptosis. Telisotuzumab is a weight-based drug that is dosed at 1.9 milligram per kilogram up to a max of 190 milligrams for patients who weigh at least 100 kilograms. And this is administered intravenously over 30 minutes every 2 weeks until disease progression or if the patient experiences side effects that drastically impacts their quality of life. For common side effects that patients can experience with the use of this drug, they are peripheral neuropathy, fatigue, decreased appetite, and peripheral edema. It has pretty low emetic potential, but for drug interactions, strong CYP3A inhibitors such as apixaban, macrolide antibiotics, and antifungals can increase the AUC of MMAE, which can increase the risk of side effects if used together. For dose reductions, if a patient experiences adverse events that does impact their quality of life, the recommended dose reductions go down in increments of 0.3. If a patient experiences side effects that drastically impact the patient's quality of life to the point where even the 1 milligram per kilogram dose is not tolerable, then it's recommended by the manufacturer to permanently discontinue the drug. Now, for placement therapy, the NCCN guidelines recommend this drug mainly as an option for subsequent therapy in those with advanced or metastatic disease if other preferred lines of therapy were unable to prevent disease progression. The Lumosity trial is a phase 2 multicenter, non-randomized two-stage study in which the first stage aimed to identify which histology is best suited for the drug. The first stage found that patients with c-Met protein overexpressing non-squamous EGFR wild-type disease had the best response to telisotuzumab. The second stage aimed to further assess the safety and efficacy of the drug, and this involved 172 patients who previously had 2 or less lines of therapy. Now, to describe the inclusion and exclusion criteria for the Lumosity trial, they included patients who were at least 18 years of age, had good performance status, and those with stable brain metastases. They excluded patients who had previous radiation to the lungs within 6 months or have a history of interstitial lung disease or pneumonitis that requires steroids. It makes sense for them to exclude this patient population to prevent confounding the results of how efficacious telisotuzumab can be for more advanced disease. And it's also good that they did include patients with brain metastases because 10 to 20% of all non-small cell lung cancer patients do develop brain metastases. And this percentage is even higher with those with more advanced or metastatic disease, where it can be up to 26% at initial diagnosis. With the patient characteristics, it's also pretty representative of patients with non-small cell lung cancer, where a majority of patients are current or former smokers, received platinum-based chemotherapy and immunotherapy, which is in line with what the NCCN guidelines recommends as a preferred treatment for advanced or metastatic disease. And a majority of patients were also male, white, and the median age was 65 years of age. For the results of the Lumasi trial, the overall response rate was around 29%. The CMET high group had a better overall response rate and median overall survival than the CMET intermediate group, but it did have a slightly lower median progression survival compared to the CMET intermediate group. Peripheral neuropathy was the most common side effect that patients did experience in the Lumasi trial, and it was also the most common grade 3 or above adverse event as well. Around 22% of patients did have to discontinue Telisotuzumab due to listed side effects, and unfortunately, 2 patients did pass away due to interstitial lung disease and respiratory failure that could have been related to the use of the study drug. For the strengths of the Lumasi trial, the baseline characteristics of participants are pretty representative of patients with non-small cell lung cancer and applicable to patients at Lyman Health based on the demographics of the patients that did participate in the trial. In addition, by separating a participants by the extent of c-Met protein overexpression, it also further illustrates the efficacy for different patient populations based on their genetic alterations. But one glaring limitation due to the fact that it is a phase 2 study is the fact that it did not compare Telisotuzumab to other standard of care treatments. So the extent of its efficacy is difficult to really pinpoint and generalize to a bigger population of patients with non-small cell lung cancer. And since the mutation is pretty uncommon, there was a lower sample size, and it also further confounds the extent of its generalizability to a bigger population of patients with non-small cell lung cancer. Fortunately, there are ongoing phase 3 clinical trials looking to compare the efficacy of Telisotuzumab to other standard of care treatment options. One example is a study that's assessing the disease activity and adverse events of Telisotuzumab to docetaxel in adult participants with previously treated non-squamous disease. The other trial was going to compare Telisotuzumab in combination with ozartinib or standard of care chemo, but AbbVie did withdraw this study due to strategic considerations. I hope you all learned something today. And if you do have any questions, feel free to reach out to me at cchan1@monument.health. Thank you.